When the reality of the pandemic started setting in last year, museums and other organizations understood the need to preserve this moment in history. They started collecting artifacts like PPE, signs showing support for healthcare heroes, and vaccine vials. Dr. Tara Narula got a look at their efforts and tells us why this initiative is so important. Good morning, Tara.
Good morning, Adriana. The pandemic has left a mark on each of us. As part of an initiative by Made by Us, history and civic organizations and museums are banding together to collect COVID-19 libraries, a time capsule of 2020 that includes the voices of healthcare workers.
I'm hoping to not have to go back into that ICU ever again, to be honest.
Over the past year, ICU nurse Missy Chen has been recording history.
Medicine as I know it right now is not working for these patients.
Detailing lessons learned from COVID-19.
He's sick, he's young, he has no major comorbidities. I found that it was a way for me to really process what I was seeing, what I was feeling, and sort of get it out there. I think it saved me.
She's part of a community called the Nocturnists, healthcare workers who come together to share their stories, experiences, and emotions. What is it meant to be able to listen to other individuals' recordings and diaries?
It's been very comforting and less isolating. In a way, it's this sort of shared collective trauma.
It's a very powerful thing to listen to these voices of healthcare workers who are going through one of the most dramatic plot twists in American medical history.
When the pandemic hit, the Nocturnist founder, Dr. Emily Silverman, started putting together an audio library of the voices of doctors, nurses, med students, hospital chaplains, anyone risking their lives for COVID patients.
When I get to go to sleep, all I think about is, did we do enough? Were we ready enough? Did I help enough people?
More than 700 of these recordings will soon be on display at the U.S. Library of Congress.
It's really been one of the most tragic moments I had witnessed.
What did you learn from listening to some of these audio diaries?
One thing that I realized is the importance of leadership, the importance of touch and connection, not just with our loved ones at home, but in the hospital.
I haven't shaken hands with a patient in 2 months.
Other themes is this idea of sacrifice, what it means to be a healthcare worker, what it means to be of service.
The Nocturnist work is part of a bigger movement by Made by Us.
My wish for us.
My wish for us.
My wish for us is for our country to become the moral beacon of the world.
A nationwide collaboration with over 100 historical institutions and museums working to preserve COVID's history in real time.
This collaboration is to focus on younger generations and to help them to understand the importance of history.
Louise Mirror is the CEO of the New York Historical Society, which is collecting COVID-related documents, photos, and artifacts.
In order to benefit from history, you need to collect and preserve your own present moment.
So it sounds like what you're saying is how we save and how we represent history is actually not just about looking backwards, but it's about what we're able to then bring collectively to our future.
The curious thing about many people's perception of history is that history is the dead past, and that is so completely untrue. History is about today.
Their collection ranges from a baby blanket from a birth at the height of the pandemic to footage of a deserted New York City and a Spider-Man statue that was placed outside of a hospital to thank frontline workers like Missy.
Having these collective experiences, I hope, will make people understand what it's been like for these patients, for the families, for all of us.
These organizations are also collecting items like pots and pans, which I never would have thought to collect, but that helps us remember those intangible moments. It actually reminds me of my own 2 daughters running into the kitchen to grab their pots, pans, and stand at the door and cheer for healthcare workers every night at 7 p.m.
Yeah.
Such a powerful memory for me.
Yeah, me too, Tara. Listen, you were one of the first people to start telling us about the healthcare workers. I'm so grateful that a year later, fortunately, you're still telling it, but I am glad you are telling the story. Thank you, Tara. We all know the story about banging the pots and pans. And I like this Nocturnist, what it means to be a healthcare worker. Yeah. Please, so we never forget. Thank you, Tara.